Now, it is very important to initiate breastfeeding within the first 30 minutes after delivery. The moment your baby comes out and then you are done cleaning you up, request that you want to feed your baby. So when you take the breast out, four fingers down and then the thumb up, you see it's already in the mouth of the baby. Okay, so you don't just put the nipple into baby's mouth. Okay, the areola, you see all the milk that is being prepared comes to store at the areola. That is the black area we all see with the nipple at the center. So that is the part that almost half of it should enter into baby's mouth. So it goes this way, four fingers down with a thumb up, the baby supported this way, and then nipple and the areola black area into baby's mouth. Now you see that when it's properly attached and baby latch on properly, the mouth curves. So just like this, the breast don't go to baby. Okay, you see most of our mothers struggle do this when they are feeding, and it's funny sometimes when you go to town, the breast itself finds its way into baby's mouth while mother is doing some things around, but it all has its own problems it gives to you afterwards. You need to do proper attachment. You, the mother, you need to be comfortable, okay, seated with a chair that has a backrest, okay, with your legs or feet resting on a stool or comfortable. You should be comfortable to breastfeed, right? So with your baby, skin to skin, okay, feel your baby, abdomen to abdomen, right? So there should be alignment of baby's arm and then the leg, okay, it should be in alignment. Your palm should support the butt or the buttocks of the baby. The side should support the back, and the head of the baby should be at the crook of your arm. Okay. So when you do this, baby's mouth is already to the breast. So the moment you take the breast out, now four fingers down. Gone are the days where we do the scissors. Okay, everybody knows that when you take it to scissors. But now we say that four fingers down and then the thumb up so that you don't block the duct that the milk flows through. So four fingers down and then the thumb up. Don't just put the nipple into baby's mouth, okay? The areola, which is the black area that you all see, is the part that the milk is stored. Okay, so when about half of that enters into baby's mouth and baby applies pressure by sucking, baby gets the good amount of milk that is required. Finger, four fingers down, thumb up. It puts into baby's mouth. Ensure the areola goes into baby. When it's properly attached, you see that the lower lip curls out a little, and then the chin rests on the breast, okay, and then baby starts to suck, right? So when baby starts to suck, just like I'm feeling that baby is sucking my breast, you don't just say for a few seconds that, oh, this baby doesn't like eating too much, it's just like the dad. No, you feed this baby one breast, make sure it is empty, so we can stay on one breast for like 30 minutes, and then you move to the next breast, okay, ensuring the same position, and then you breastfeed for 30 minutes relaxed, not stressed out in the position, and then be singing with your baby, giving some cheek strokes. What they do is to rest in between their sucking, okay? When they're sucking the breast, they rest in between, and that doesn't mean they are full, okay? That is where you flick their cheeks, communicate with them, sing. That is the bonding you are trying to build, okay? Now, as they remember that, hey, we were doing some job, so let's continue. That is where they start to they continue with the feed. And in 30 minutes, you are sure that baby gets enough milk. Now, when you are done, it's very important to burp up the baby, okay? So there are so many ways where you put baby on your shoulder and then try to pat the back, baby bells up. And then right after that, you can put baby to bed on the side, supported with pillows or cloth. It's very, very important to ensure that you prep up the baby before you put baby down. And baby should always be on the side. If there should be a regurgitation or the fluid or milk or anything coming out, when baby is lying on the side, it can just pass through the side of the mouth onto the bed. But when baby lies on the back, the chance of a baby aspirating is high. So it's very, very important to ensure that the baby lies on the back and baby burps after feeding. Thank you.